So hello everyone, how are you guys doing? I'm Dr. Maryada Malla. I'm from Nepal.
Hi, Maryada. Hi, how
Hello,
are
ma'am.
you?
I'm fine, ma'am.
Hi, how are you, everyone? So we are here today finally to talk about the preparation and everything. So before we start our session formally, so let's have the chit chat. So I'm Dr. Zaib Qureshi and Dr. Maryada Malla is with us, of course. So
Hello. Hello, I'm Dr.
hi,
Mahabal Abuni from
hi,
Bangladesh.
hi. How are
Hi.
you?
I'm fine. How about you?
Alhamdulillah. Thank you. Okay, that's great. Question is this possible to start preparation today for January 2023? Yes, absolutely. Everything is possible. All you need is courage. All you need is focused study. All you need is focused guidance. So we are going to start in a while. Okay. So don't worry about it, Dr. Hamida. Okay. Hi, Satish. Hi.
Hello. I'm a new member for MRCOG Part 2.
Okay. Okay. That's
So
great.
I want to know the every syllabus of paper MRCOG Part 2. I'm recently passed Part 1.
Okay. Sure. We will be talking about it, sweetheart. Okay. So just hang in there, just be there. So we are going to talk. Dr. Maryada is going to give every bit of detail of exam and preparation and everything, how we are going to do. So don't worry about it. Okay. We are just waiting for a few more candidates to join in and then we are going to start our session formally. So till then, anybody can open their mic and send message and ask us any question there is. Okay.
So yes, guys, before we start the session, is there anything you would like to ask?
Hi. Okay. Very good, Satish. Inshallah, you won't be, upset by joining the course. Okay. So we are going to guide you through. So don't worry about it. We are going to, talk in detail that how we are going to go about this course and everything. So don't worry about it.
Can you hear me?
Yes,
we
I
can
can.
hear you.
Yes.
Okay. Can I take a minute, Dr. Zaib? Because
Yes.
I was trying to speak to somebody one-to-one, so I got a chance today to speak.
Sure.
Actually, probably I may be the senior most candidate for your MRCOG course in your life, probably. Okay.
So what? No. You cannot be
Well,
more than senior than me. I'm the senior most here.
really? Okay. I'll tell you. I am 54 years old.
So what? You are 54 year young. Don't say I'm old.
No, I'll tell you. I'll tell you why. I'll tell you why I have joined 2023 MRCOG Part 2.
Okay. Yeah.
Actually, I have already finished my post graduation in MD
Oh,
Ops
wow.
Gynae in '93 in India.
Okay.
Very great.
I did my IVF training from Dr. John Webster and Thomas Matthews at Nottingham Hospital in 1995.
That's brilliant.
Yeah, that's
I
great.
have done my fellowship in IVF from Brussels. I have done it from Norfolk, Virginia. I have done it from Sydney IVF. I have done it with Turkey. I have also got trained in PGD fish and PGD
Wow.
single cell PCR with Joyce Harper in UCL.
That's brilliant.
I run a big PGD PCR program.
You're making me feel jealous now.
Okay. I run a big PGD PCR program
Oh, wow,
in India.
mashallah. That's very great.
I think we should join Dr. Satish for that.
Exactly. We should join. Now I'm getting tested.
I'll answer your question. I'll answer your question.
Okay.
I delivered the first PGD pregnancies for Nigeria.
Oh, wow.
For Ethiopia. I started, I'm supposed to be known in India as the first fellow to do transport PGD.
Very good. Brilliant.
Okay,
That's nice.
Ethiopia and Nigeria were transport PGD cases.
Okay.
Now, my problem is like this. I am supposed to start the PGD program for Middle East. Okay. And believe me, they are not ready to take my logbook. They are not ready to. I do about 400 plus pickups and transfers in a year. Okay. But they want me to give the, what do you call, the pro-metric exam. Okay. And they want me to give the exam which is actually going to cover the MD Ops Gynae portion. Okay, because they do not have a program
Yes.
for IVF. So the reason for me joining MRCOG course part 2, I already started coping up with Pradnya. I will be having the first session tomorrow probably. So
Hello.
Yes. Hello. We can't hear you, Satish.
Yeah. I think you went offline, ma'am.
Yeah, maybe. But it is brilliant.
I think
See,
we should get
Maryada,
training
I
from
mean,
him, ma'am.
I was just thinking that, now, we are getting, the kind of motivation to become the infertility consultant. Remember the
Yes,
other day we were talking?
working, yes, ma'am.
Okay,
Guys,
okay.
so much.
I know. There is so much.
I think he's
Okay.
motivated everyone, all the participants as well.
You can unmute yourself, Satish.
I'm doing.
Okay.
So
Yeah,
actually,
please.
my reason to come to this session of yours was a small apprehension which is there in my mind. I have read most of in last 3 months, I'm doing the same job. I'm
Okay.
trying to read, which I read in 1993.
Okay.
Okay. I have finished all Obbs Gynae books. Okay. I have
That's
tried
great.
to solve all MCQs. But what I realized at the end is probably the pattern which
Yes.
we are used to is not the same pattern
Yes.
in the pro-metric exam,
Yes.
Okay. So
Yes.
that was my main reason to join the course. And my apprehension was, I plan to give the exam. It's an open-ended exam. My all documents have got verified by the embassy. So I have to only take a date to give my exam. So probably I am looking at that if I am able to complete the portion with you in December, Jan and February, November, December and January, then maybe 1st or 2nd of Feb, I can go and walk in and give my exam for the MCQ. So my apprehension was, will these 3 months be okay enough for me to at least answer 70% of my MCQs, if not all?
The answer is yes. Why? Reason being that you already are working as a consultant. Okay. So infertility and the kind of gynecology or the benign gynecology is not going to be troublesome for you. You just need to focus on the ops part, and with us, inshallah, you are going to revise the whole stuff. And we have made a very the kind of a unique plan to revise for January batch. So don't worry about it. And I hope the team has shared with you guys in the study room or no, but soon they will share. So this way or that way, we will try to
They did
cover
to me.
as
They
much.
did with me. They did with me.
Okay.
I too have made.
Okay. So don't worry, Satish. We are going to help you, and trust
They
me.
did share with me.
Okay. That's brilliant. So all you need to do for the prometric exam is, I think now you need little bit of obstetric part. Now you need little bit of maternal medicine part. Okay. So I mean, we have made the kind of comprehensive schedule, I think, which is going to help you. Okay. So don't worry about it. And I think if you are well read before entering into the course or before entering into any of the revision sessions, so I think you can do it quite easily. Okay. So I don't have any the kind of doubt about it that you cannot do it. All right. But you, of course, because the MRCOG study, it needs little bit focus. It needs little bit the angle, that how to look at the question, how to solve it, and how to perform it. Okay. That is the biggest challenge, that how you the perceive question, because I think in Prometric there are only MCQs, if I'm not wrong. Okay.
Yes,
So
yes.
yes, so it means that you don't have to put, the extra effort for EMQ part, which is solely for MRCOG Part 2. Okay,
Correct.
but if you are going for the January MRCOG Part 2, then of course you have to put the the equal amount of effort for EMQ. But I think it is going to save you. Rest,
See,
the I can guide
see
you in person as well. No problem.
yeah, what I realized at the end of the day
Mm-hmm.
is whether it is this or that, the clinical conclusion is going to remain the same, whether I get an
Exactly.
answer in 4 MCQs or I
Yes.
answer a clinical question at the end of the 10
Exactly.
lines which I read from up.
Exactly. Because the Royal College guidelines are kind of internationally recognized guidelines. So I mean the answers are going to be the same. Doesn't matter if you are studying for MRCOG, doesn't matter if you are studying for any of the exam. Okay. And you won't believe with
I
this MRCOG study, I myself have done, the two boards, the extra boards
okay.
along with this,
I don't know.
the MRCOG
Yesterday,
study.
actually, just yesterday, I met your. I think she's your ex-president. I know. I think she is your present president of Leslie, Dr. Leslie. She is
Yes.
the
Dr.
president
Leslie
of
Morgan. Yes.
MRCOG. I met her
Yes.
yesterday in Mumbai. I was there for the
Uh-huh.
conference yesterday.
Yes,
Okay.
yes.
So I actually, when she heard my story, she told me, Doc, when you're giving part 2 so seriously, why don't you
Mhm.
finish off part 1 and part 2 and become an MRCOG fellow only? I said,
Yes.
I'm not so keen on that because for me, it is for, see, my job in putting up the Middle East is to put up uh, 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 um, a most advanced molecular lab. Okay, I
So
don't know how much
inshallah, you will be
concept,
able to do
I
it.
don't know
Okay.
concept what you have. I actually do pre-implantation genetic diagnosis for single gene
Hmm.
defect with HLA match. So
That's
I give
very
a
good.
savior sibling concept in
That's
India.
brilliant. That's brilliant.
Okay, so
That's
now
brilliant.
I'm supposed to put up this main center in Middle East.
That's brilliant. That's
Okay,
brilliant.
so I thought let me attend today your queries because I had some queries which probably other students will ask. So I was, day before yesterday also when I was on the Telegram group and I was seeing people putting up. Now I have about 300 Telegram questions to be finished before 7:30. But I said, no, I will finish it later at night. Tomorrow I will join the session with Pradnya and I'll try to cover up all the topics,
Yes,
not
yes.
sleeping overnight. But I'll finish them off because since you have read them for the exam before it doesn't evaporate, you just need to replenish the data. That's all.
Absolutely. Revision is must before every exam, and this is very
Yes.
good of you that you are not taking any exam lightly, and this is the spirit we all need. Okay, so I hope the candidates will be so inspired who are with us, and in fact, we already are. Me and Maryada, we both are so impressed. So hopefully, we will see you one day for the any of the other thing if you they come to the Middle East. So perhaps it will be easy
Definitely.
for me to travel around and to come over. Then
Definitely.
inshallah I will definitely, I would love to see you in fact then in
Definitely.
person as well.
Definitely.
Okay,
Definitely.
so
Definitely.
thank you so much Satish. So
Thank
so over to you
you. We
Maryada,
wait for
you
Satish.
can start.
Yeah.
Oh yeah, thank you.
Thanks a
Uh,
lot.
and thank you, Dr. Satish, for coming and motivating not just the participants, but both of us as well.
Yes,
So yes, now we'd like to start with our session. Okay,
yes.
so mostly our session today is guidance about preparation for part 2. And the million-dollar question, I would say, when should you start preparing for your part 2 after you succeed in part 1? Okay, so that's a million-dollar question. So I'd like to congratulate all our students who passed part 1 exams. Okay, you guys are now one step closer in achieving your goals. Okay, so I'd like to ask how you guys are feeling.
Yes, congratulations, big congratulations to everyone.
Anyone can just unmute themselves and just express. I have seen most of the videos, some from my own colleagues, and that made me feel really great. Okay. So what is our agenda today? Okay, that's broken down into following points. Firstly, we will discuss what's the basic difference between the part 1 and part 2 exam. Secondly is what a part 1 student should expect from the part 2. Okay. And as I already said, the $1 million question, when you should start preparing for part 2. Okay, the fourth point would be our general strategies to study for part 2, as it is a little bit different and a level up from part 1. And is there any study schedule that we have for part 2, which we definitely have? Okay, so we will go to each of our points one by one. And if you guys have any questions in between, you are most welcome to either type in your chat box, or you can unmute yourself and you can ask us. So this is a table showing what's the difference between the part 1 and the part 2. As you guys have already done with your part 1, kudos to that. See, part 1 is basically, it was evaluating your understanding of basics and the clinical sciences. Okay. Whereas for part 2, it assesses your application of knowledge. Okay. You had like single best answers for that in your part 1, whereas we have that in part 2 as well. But we also have the extended match questions for the part 2. So what we have to remember is this part 2, no, it forms the base, okay, for your clinical exams. That is for your part 3. So when you give this part 2 examination, in this you cover all the theory portions that is required, okay, for part 2 as well as part 3. It's the foundation. So all the guidelines that we have from RCOG, so it's in the part 2. So what we expect from part 2, okay? So you should know what the exam structure is like, okay? It's basically a computer-based testing that we have. Even like in part 1, in part 2, we have 2 papers, okay? Paper 1 and paper 2. So both will be the computer-based testing. And each paper, they have same number of marks, okay? There'll be 50% of the marks in paper 1 and similar for same for the paper 2. Okay, and in each there will be EMQs and SBAs. So we can see here the burden of marks for EMQs is much more. It's 60%, whereas it's 40% for SBAs. Sometimes what we feel is paper 1 is obstetrics and paper 2 it is gynecology. We may feel like that, but it's not like that. Okay, it's basically mixed. You get obs and gyne in paper 1, obs and gyne in paper 2. But in each we have this SBAs and EMQs. So is there any doubt in your, if so you can ask, okay?
Are the questions same? I'll put it in some other fashion, and the average is assessed, or there are 2 independent papers?
Okay, so what we have is we have this paper 1 and paper 2, okay? It's not that you have separate pass marks for paper 1 and separate pass marks for paper 2, separate for SB and separate for EMQs. The combination of the marks will be taken, and then it will be based on the standard. Okay, have I answered your question, Dr. Satish?
No, combination means what? Suppose in first 100 question, first paper of 100 MCQs, I have answered 60% or 60 questions right. And in second one, I have answered 50 right. Then is it 50 plus 60 divided by 2 with an average of 55? Or there is some other formula?
So it is not done like that. So that is the, this is the standard setting way it will be done. So the it will depend on how your other colleagues have performed. So it's the percentile based. Okay.
Okay.
So hopefully I've answered the question. So another part is what we expect from the exam. So we, as I said, we have 2 papers, paper 1 and paper 2. Okay. For each, the duration is 3 hours or 180 minutes. Okay. And the number of questions we have is 50 SBAs and 50 EMQs for paper 1. And then same for paper 2. So this will be divided into 2 by our lunch break of 60 minutes in between. Okay, and trust me, that is the shortest 60 minutes of your life. It will just pass by. So how you, though like candidate, they can use their 3 hours given, however they find it feasible. But what we recommend you guys is like to use like more time to EMQs, because the questions are long. The options given, like sometimes in the exams, option can be given from A to Q or A to O. So options are a lot you have to go through in EMQs. So, and there are just simple changes in words and you don't know which the right question is. So we would advise not to waste too much of time in SBAs. So how we think like you can divide is like you give out of 180 minutes, you give 70 minutes for your single best answers and you dedicate 110 minutes to your EMQs, because it really takes a lot of time to go through the questions and options and pick the correct ones. Okay. So as I have mentioned before regarding the marking, there's no separate pass marks for the single best answers and the extended match questions. Instead, it's a combined pass marks. Okay. So it's determined by the standard setting in the each exam. We cannot say that last time the pass percentage was 60. So this time I got 60, how I can fail. So it's dependent on the standard setting. Okay.
Okay. What is the difference between, ma'am, excuse me, what is the difference between single best answer questions and extended marks question? And what is the difference actually?
Okay, so the difference is in the single best answers. So you have usually 4 options given to choose from. Okay. Whereas as the name suggests, like it's the extended match questions that you will only have one correct answer, but there are multiple options given there. Okay. So like I said, like in exams, it can be
only one answer from that all.
Pardon, I couldn't hear you properly.
From extended marks question also, we have to pick only one correct answer.
Yeah. One, there will be like number of options given, okay, like from A to Q or A to O, whatever above. And then there will be 3-4 questions. For 3-4 questions over there, there will be only one right answer, but the options from that you have to choose. Sometimes there can be right answer for both the questions. There can be single right answers. So you have to be very careful in that. Okay. Okay. So
excuse me, I don't understand your answer. Please let me explain about EMQ and SBA.
Yeah.
Again.
Okay. So for SBA, what happens is you have a single question. For that, you will have out of 4 options, you have to choose one correct answer. Okay. Is that SBA clear? Single best answer?
Yeah. Yes.
Yeah. So now for the extended match question, what happens is first there will be options given. Okay. There will be options given from, let's suppose, from A to Q. Okay. There will be A to Q. There will be options. And then there will be 3 or 4 questions below that options. And you read through the option, the questions. And after reading the question, you have to choose from A to Q. You have to choose one option for the answer. Let's say for question number 1, you choose one option like B. Okay. And you read another question number 2. Okay. So what happens sometimes, even for question 2, right answer or right option from the given options could be B. It's not necessary that you have already chosen B, so it would not come as the right option for the next question. Okay. So in this, there will be the clusters of question given. Usually 3-4 questions will be given, and you have to choose the correct answer from the given options.
You have one example, can you please share it?
I would love to share it, but
no problem. Let me share. No problem. I'm here. Okay. Because I have already been opening it. So guys, let me simplify it for you guys. Is that, what will happen is that in single best answer, there is going to be 5 stems, right? What you did in your part 1. Okay. So similarly, in the part 2 as well, there is going to be the one part of the exam which is going to be the same single best answer. The other is going to be the extended match question. So how extended match, as name says, extended means that there are going to be multiple options, and then you have to the choose out of them. Of course, the options are going to be A, B, C, D, E, F, from A to the couple of options. It can be up to K, it can be up to Q, it can be whatever. Then the below those options, there are going to be 3 or 4 questions. Okay. For out of all those questions, you will have to choose out of from A to whatever number of questions are. Okay, clear now? Let me show you the the books, the the
An
as well,
example,
because
if you
yes,
share,
sure, because it takes time to open things. Okay, I'm
yes,
sending,
yes,
no
yes.
problem. Okay. Oh yeah, there it is. Okay, so can I share my screen, please? Okay. Okay, can you guys see now? Can you guys see the screen, everyone?
Yes,
Yeah.
yes,
Yeah.
Okay,
yes.
fine.
We are able to
So
see.
for example,
Ah.
this is a case of medical legal issues. Okay. And here we have got options A to O. Okay. And now your question is, for each description below, choose the single most appropriate answer from the above list of options. Each option may be used once, more than once, or not at all. Okay. And the question is, for example, this is question number 1, this is question number 2, this is question number 3. For every question, you have to scan answer from A to O. For example, if you feel that for the question number 1, the answer is D, okay, click D. For example, you feel that for the question number 2, again, option is D, okay, choose it. If you feel that, the question number 3rd, the answer is none of the above, so you will choose O, option O. This is what we call it as, the extended match question. It means that you have, the extended, the numbers of options. Plus, out of these extended number of options, you have to, the choose for all questions. Okay, is it clear now?
So it's like based on the options, they are framing the
Of,
questions.
of
It's like
course,
that.
of course,
Yeah,
of
yeah.
course. Okay.
It's like that.
For example, this is a topic
Mm.
cesarean section. And then, they have, the question, the 3 questions. A 32-year-old lady who is para 2 with a previous cesarean scar undergoes an elective repeat cesarean section. Difficulties are encountered during peritoneal entry. Urine is found to be blood stained at the end of surgery. A methylene blue test show a 2 centimeter rent in the dome of the bladder. Okay, so what was your task? For each description below, choose the single most appropriate answer from the the above list of options. Okay, so it means that now you have to choose which one fits best. So it is clearly the bladder injury at cesarean section, right? So I mean, out of that bladder injury, now you are going to quickly scan that what you will do. Okay, inform the anesthetist, senior surgeon, perform end-to-end anastomosis. This is for gut, this is not for bladder. Okay, cut. Interrupted non-absorbable sutures and a catheter in situ for 10 days. Okay, it makes sense. So you will, the short list. For example, 2, 3, the options, you will see that, okay, it feels like that, it is correct. All right. So of course, then you are going to, they choose that which one fits best. Okay. For example, you have chosen your, the answer K. Okay, you will write down, you will tick the answer. Question number 1 is K. Then question number 2, then you will scan all, the options. Why EMQ looks so, the kind of tricky? Because for every question, you have to scan all options. Okay, that's why it needs a lot of rehearsal, it needs the thorough study, it needs the a lot of practice as well. So certainly these are not 5, right? 1 2 3 4 5, this is more than 5, or in fact you can say 10 or 15.
Yeah, sometimes it can be up to Z also, like last
Exactly. In my exam, it was up to option W. Okay, so it was
Can there be
So for all the 3
two answers
questions,
also right
you
for
have to-
one?
sorry.
Can there be 2 options right for one question?
No, usually they don't, they formulate such questions. Okay, questions are going to be clear. There is going to be big difference. For example, there is interventional radiology and unilateral uterine artery embolization. And the other question,
Okay.
the other option is intervention radiology and bilateral uterine artery. So this is us. This is up to us that what do we choose. Okay, I mean, by the apparently it will look that okay, it also look correct, it also look correct, but what is going to be the correct option? This is, and this is your exam. This is what you have to master on. Okay,
Okay.
I hope it is clear now, everyone. Clear, everyone? Amna, is it
Yes,
clear to you
yes,
as well?
yes.
You were asking.
Yeah, it is
Yeah.
clear, ma'am.
Yeah.
Okay, okay, very
Like
good,
for
very good.
for 3 questions, we have to scan all the options
Options.
every time.
Exactly.
Yeah,
Yes,
got
yes, yes. Yes, very good, very good.
And like, did you guys notice what Dr. Zaib did? She first read the questions. Okay, like she first read one question and then she scanned the options, because like options are given first, so we have the habit of going through the options. So before
Yes,
reading the
yes,
questions, if we scan the options, then we get lost sometimes. Okay,
yes.
when we read the question, we have certain option in our mind. Okay, this could be the correct one. So after that, if we start searching from the option, the life will be very easy.
Yes, yes.
Okay, that's great.
Like
Okay,
for
Maryada,
these
carry on.
options from A to Q,
Mhm.
there will be 3 questions, or like
See, sweetheart,
how
I mean,
many?
it
Could be
always
more than
depends
three.
upon,
Yeah,
yeah, there can be
more than
3, there
three.
can be 4 as well. Okay. So, I mean, we
Okay,
can't
okay,
say that, every time it is going to be fixed. It's all up to, the college,
okay,
okay, how they are going to, the
okay,
formulate. But for the every question, we will have to scan from option A to Q. Okay.
Yeah.
okay, okay.
And this full set is considered one question, or the
No,
lower four
no,
are
no,
considered
no,
as
no,
4 questions.
Each
no.
separate.
Yes, it's separate. 4
Separate.
questions, mean
It's
4
separate
questions.
mark.
Yes,
Yeah.
separate marks. 4 questions.
Okay, okay.
Yeah. Okay. Okay, Maryada, thank you.
Yes, ma'am. Ma'am, I
Yes,
think.
I did. I did.
Okay, thank you, ma'am, for clearing it out for
Always
everyone.
there. Always there.
So, regarding this exam life cycle, we first should be obviously to give part two. We should have passed our part one, and we have to form this expression of interest. Okay, and after that, we will be getting a booking token, and when we get a booking token, then we will do our exam booking. Okay, in the Pearson View Center. So we have to like mark the calendars like during the opening and the closing dates of the expression of interest. Okay, and also for the exam booking, because what I did during my time was I had to sit for my part 2 exam in September 2021. I had filled my expression of interest form. I had done my center booking at Nepal, but when I got the mail to book my center at Pearson View, I got the mail. I thought I'll do it tomorrow morning, and I just left it. At that time there was 13 seats available, but next morning, when I opened my laptop and I wanted to book, every seat was fully booked. That's why I had to give my exam on January 2022. So don't do that blunder. When you get the mail, immediately keep a reminder, first of all, of the opening and the closing date. And don't wait till the closing date. Okay. I would advise you, when there's an opening date, just do the booking right at the time, because like seats get full so fast, and you will have to unnecessarily wait and waste your time. So at least learn that from my mistake. So like somebody asked in the chat box, like what percentage is SBA and EMQs? So yes, EMQs are scary because the questions are long and options are long as well, and it carries burden of 60%. Okay. So
Okay.
basically talking
Ma'am,
about,
for paper 1, 100 questions are there?
yeah,
Yes,
and
Like
paper
yes.
paper
for
two
2,
also 100 questions.
Both papers,
so
100, 100
50,
each.
50.
Okay. And
Okay,
out of them, 50
50%
are going to
this
be
SBA.
50
Yeah,
questions
Yeah.
SBA, 50 questions EMQ.
EMQs.
Okay.
Okay, okay. Thank you.
Okay.
Okay. So coming to our overwhelming curriculum, okay. So like bulk, as you can see, the size is bigger of GTG. So it carries 60%. So you cannot sit in the exam if you've not gone through this green top guidelines. Okay, you must and have to go through this GTG at least 2 to 3 times. Okay, and the second bulk, it is formed by NICE and TOGs. Okay, so these guidelines are must to do. Without this, we cannot like really have the confidence to go in the exam and sit, because we will definitely fail if we don't carry this bulk exam in the curriculum. Okay. And another we have is FSRH, that is Faculty of Sexual and Reproductive Health, and the BASH guidelines. It's the British Association for Sexual Health and HIV. Okay. Also this consent advice, membranes, and scientific impact papers. We have these as well. But we definitely, when you are joining the course, each and every important portion from all these will be covered. You do not have to worry about that. but we have to give more focus on the bulks, okay, which is the green top guidelines, NICE, and the talks.
One question I have.
Yes.
The study material which you have given, the GTG guidelines, you have given it in a PowerPoint presentation as a slide.
Okay.
And the guidelines are actually the actual guidelines. So am I supposed to go through the first guideline and then see your PPT, or just your PPT would suffice?
Dr. Satish, I would advise, like, first go to the guidelines once, okay, so that you go through all, you roughly get the idea. And then after that, if you go through our PPT, you know where you have to focus, okay? Sometimes what happens is, like, if you just go through the points, it might be difficult to register some of the details. But once if you have gone thoroughly to the guidelines, because that what Dr. Zaib taught us when I was a student, and that really helped me a lot, because like for some things like for TOGs or for SIPs, if the time does not permit, yes, you can go through summaries, okay, few of them. But for GTG NICE guidelines, I would advise, like, once go thoroughly so that you get the rough idea, okay? Sometimes even the residual knowledge, what you read, it would appear in the exam and it would be very easy.
Okay, so what I can understand is, we need to first read the guideline for the topic which you have, then see the PPT, and then read, I should not say read, be in the Telegram group to see all the discussions which is happening, and then be prepared for the live session. Am I right? This would be the steps to read the live session.
Yes.
Okay.
So what we used to do was, there used to be this mini schedules that would be posted.
That's what I'm saying, the mini schedule. So you read in the morning the mini schedule, evening you are in the Telegram group discussing the points, and after a week you are discussing all the 14, 16 topics in that session.
Yes, exactly.
Yes. Because when you do read by yourself and do that, like some things that might not be clear, you can directly ask with the mentors when they are online teaching on the live sessions. That was we used to do, right, ma'am?
Yes,
We would
exactly.
ask so many questions, though she would make everything so clear. Like Dr. Zaib is like, she's always making the concepts clear rather than like making us mug up the things, because it's impossible for us to literally mug up things. What she does is makes our concepts clear. Like all the mentors, they do that.
Exactly.
Okay, like
guys, is it clear that what is GTG? GTG is RCOG Green Top Guideline. Okay, and RCOG Green Top Guideline can freely be downloaded from www.rcog.org.uk. Okay, and NICE guidelines are also to be easily downloaded from NICE website. If something you cannot get it easily, you guys can just write it in the study room, so we can provide it. Some of the TOG articles, okay, TOG articles are also from Royal College guideline. Every year they release, the 4 TOG articles. Like, I mean, every 4 months there is going to be one issue: January, July, October. Okay, and this is how it comes. So the January, April, and then October, and then in the end again. All right. So there are going to be the 4 issues, and every year, every 3 months there are going to be the 4 issues, and out of those TOG articles, you have to cover the important ones. Okay, first. And if time allows, you can read, as many as you can. But on the Medexam expert website, so we already summarized, the couple of things over there. So if you don't have enough time, so you can quickly go through all summaries, and you can just, declare out your doubts. Okay. All guidelines are freely available.
One more small question. In the WhatsApp thing, I got a link for the Google Drive. And there was some
that is for
course.
That is for course material. Okay, that is not open.
Yeah, I got it. I got it. But what I just got registered day before yesterday, so I could only download from the Google Drive yesterday.
Yes, you can.
So I didn't go through it. Now tell me one thing. In that Google Drive link, are the green top guidelines of the RCOG given, or they are also only the PPTs?
No PPT, but the whole content. Okay, it is module wise, the content over there in that drive. So it is for your, the easiness that, okay, you will
No, I
quickly
did
open
that.
that
What I
link.
did actually was
Yes,
I,
yes.
I, I couldn't download because it got downloaded
Hmm.
somewhere else. So I went
Hmm.
to the RCET site and I saw all the links on the left side.
Yeah,
And
yeah,
I saw
yeah.
year-wise they have given from 2008 till 2022. So
Exactly,
I think the
exactly.
latest one they
That
have
is
given
that
is
is a
about
very
colitis
beautiful.
cases.
Exactly,
Yeah, it
exactly,
is the latest one is colitis cases in pregnancy. I don't
exactly.
know.
Yes, yes, yes,
That's fine. I
yes.
got it. I got
Obstetric
it.
Uh,
policy.
Thanks.
Ma'am,
Yes.
regarding the Green Tube guideline and TOG and
Mm-hmm.
NICE, so it will not be provided by the course. I have to download them or what? I
No,
didn't
no,
get the
no.
point.
We are telling you that you can download it yourself as well. If you don't find the link
Ah,
yourself, you can ask us. Okay, simply. we are
but
just
it's
showing you the ways. We are just showing you the ways that how you can,
ah,
because the course is so vast, because the things are so vast, and we all live the so many hours the apart. Sometimes you have we sent a message, and of course if we have the couple of hours difference, so I will see after like 6 to 7 hours. So what you will do in 6 to 7 hours, try to the search as much as by the time you will finish your part 2, you will be master in searching and surfing, trust me.
ah.
This is what we have learned.
One, one silly question from my side. It may sound
Sure.
very silly. Any exemption to part 1 exam?
No, there is no exemption. They have ended that exemption back in 2007. Okay.
Okay.
Now there is no
Okay.
exemption. Yeah.
Okay.
Everybody has to go to anatomy, physiology.
No, I thought
Okay.
probably because I've already passed out gynec ops from India,
No, no,
do I
no,
get an
no, no,
exemption
Satish.
for
There
part
is
1?
no
No.
exemption anymore. No
Okay.
exemption.
Okay.
Yeah.
Okay.
And
Okay,
guys,
Maryada. Yeah.
yeah. So guys, the beauty of this mid exam is if you couldn't find any like guidelines or TOGs from the sites also, sometimes some talks are paid and it's difficult to download. So if you ask in the group, okay, like the mentors or the backend team, they can just provide you. And if you have checked your Telegram in files also, you
Exactly.
will find many materials. If you guys have checked
Exactly.
or not,
Exactly. All you
like
need is all you need to learn is how to use search bar in Facebook,
yeah.
how to use search bar in Telegram. Trust me, everything is freely available
Everything
almost.
is there, but sometimes if you don't find also, if you'll ask, you'll just get.
Yes,
I
yes, we will
remember I used to
definitely give
ask,
you.
and like Dr. Pradnya, Dr. Zaib, they would just like post it, and it would be so easy to get the guidelines from there. I never
Exactly,
used
exactly.
those websites which ma'am shared. I used
Yes.
to get from the Telegram groups
This
only,
is
so you
just
can
for you
ask
guys
about
that
it.
of course
Yeah.
if there is the lack of the time, and sometimes of course
Mhm.
we are in a digital world, so of course sometimes internet is not proper, so at least you can have the all the ways that how to go about, how to the search and search, that's it. Okay.
Okay. So yeah, so when should I start preparing for part 2? The answer is immediately after you clear your part 1. Okay, you should not delay any time to clear your part 2. Because the answer to it is you will have the fresh concept about the exam fundamentals. Okay, like after you've done your part 1, and things is like you are more likely to remember the details of the topic. You are bubbling with knowledge. Okay, you are studied part 1 just now, you're bubbling with knowledge, so your motivation and spirit is also high. So if you take the break, like again to start studying for part 2, it becomes difficult. Okay, from tomorrow the tomorrow will never come. So it's good that you start right now. If you've like recently passed out your part 1 or whenever you have, like, just start it now. Okay, because even like all the trends
One
that we've seen in the
question.
past. Yes.
If anybody is a fresh candidate, only she has done MBBS and have cleared the part 1, can she directly proceed for part 2, or she needs any experience or
No,
in the
like they
gynec
have so
department?
many students dear, like so many students, they have just done MBBS also, and they've cleared this MRCOG all exam without doing masters also. So it's not necessary like you need any experience or anything like that. For part 3, yes, you have to have worked in this obstetrics gynecology for 4 years. Before that was the criteria kept for part 2, but now it's kept for part 3. So for part 2, it's not necessary that you need to have any experience. Okay, you
Like,
can
is it
just give.
possible? I would like to ask, like, Okay, is
Yes,
it
yes, it's
possible, like,
possible. It's definitely
if
possible
to pass
because
the
they have
exam, like, without having any practice in the gynec department, only like MBBS student, can they crack the part 2? And my
yes,
question is that.
they can. We have seen so many candidates with just MBBS degree. They have gone through MRCOG.
Oh well,
Without
look at me.
any,
I
like,
have never done house
That
job
is
in
for medicine.
the gynae. I have
Yeah,
never done house job in gynae. No knowledge about gynae. I did my part 1 and today I am where I am. Okay, so it doesn't mean.
example.
like,
Best
Oh
example for this.
part 1, yeah, like part 2 for, I have heard, like, if we have practice in gynec department,
no,
then it
sweetheart.
would be
No,
really
no,
good.
no. See, if you are eager to learn, if you are, the making your concepts clearly, if you are taking all advices by heart, so trust me, it's not going to be, the difficult. Okay. All you need is just to stay focused. And if at all, you need
Okay.
to, they understand something, you can join any hospital for 1 month just to understand, the how things goes, and that's it. You can, they also join any of the consultant in the evening OPD, or whatever you want to, because in our countries we have got plenty of resources available, isn't it? So we can always
Yeah.
grab all those opportunities. But you can always quote my example. See, I have never been a gynae person. I was into a medical medicine
Yeah.
PG. I was a medicine PG. Okay. I passed my
Okay.
medicine exams course. I started off my residency, but somehow I couldn't continue. Then I the switched my the specialty, and today I'm having 4 boards. Okay, so it doesn't necessarily mean that you have to do the same, but of course for the part 3, when you are going to go for part 3, then you need the 4 year the what you can say, the clinical experience. Okay.
Experience.
Yeah, but not
Okay.
now.
Okay.
Yeah.
Okay. Thank you.
Okay. So like
So,
schedule.
sorry, ma'am. So after if I have passed part 2, so I can take immediately part 3 or what? I didn't, yani, I
if
mean,
you
I
have
have to
4 year
wait?
experience, if you have already 4 year experience, you are working in obstetrics and gynecology, if you have done any of the training from your the country, or from wherever you are working exclusively in gynecology department, and you can take the experience certificate, you will send it for the
Assessment
what you
of
can
training.
say, assessment of training. So if RCOG accepts, you can easily go. Okay.
It should be 4 years?
Yeah, 4
Yeah,
years, you
4
can
years.
add 2 years of your residency training, and
Mhm.
like 1 year post-residency, you can take that. Or if you've not done residency, but you have to have worked in obstetrics and gynecology for 4 years.
Okay, thank you.
Okay. Okay, so shall we move on? So regarding this schedule study, okay, is it important? Definitely, I think everyone knows here now. Yes, it is very important. And having a study buddy or a study partner, it is always better. Like you have a discussion, okay? Even if you don't have a study partner, it's okay. I never had one. I used to discuss with the groups and with my dear mentors. So why it is important is like sometimes when you are studying alone, you might not be having a clear concept, or what concept you might be having, it might not be right. So when you are discussing with your friends or with mentors or in the group also, you might get a very clear concept about some things. Okay, it's not just the teachers only teaching. Sometimes even your friends, they can help you build the concepts. And there will be the discussion of exam like questions. We might feel, okay, this is the key to this answer, so this is right. But in the study group, when you post the answer, we might be feeling, oh, this is not correctly printed. Okay, because in so many books are old, and in so many books the keys are not correct. Okay, so when you have a discussion, you tend to make lesser mistakes like that. And also, will more the merrier, like more minds, there will be more ideas, and it also will be very easy. And another thing is, like when you are discussing in the group, sometimes what happens is when you are studying alone, you don't know, you don't have anyone to compete with, you don't know where others are on the board, same boat, or they're forward or they're backward. So when you are in the group, you know, okay, even if you have missed something, then, oh, I have to study because they have already studied. So it kind of gives you motivation to study more and better. So these are the schedules that we have, okay? So for January 2023, we have launched this new progressive course where you can like easily join and can clear your part 2 in 2 months. Another for regular ones, those who are appearing for July 2023, we have this regular course as well. Regarding all these details, the contacts that will be provided at the end, you can ask any one of us, okay, in the group regarding which one you need to join. So how it will be done at Medexam is, firstly, we will introduce about the course, the features, okay, how our study plans, it will move forward. And in the preparation, we have a separate study room, okay. If you are in January 2023, there'll be separate group for that. For July 2023, there'll be separate study group for that, okay. And there will be proper guidance with the mentors in live sessions. There will be dedicated moderators for the groups, okay, for the chats, for the
Yearly
daily
twice.
discussion.
Exam will be yearly twice, ma'am.
Could you please
What?
repeat?
Exam will yearly twice. The
Twice or thrice, depending
Twice,
upon,
yeah.
yeah,
Okay.
twice or thrice,
They open the
depend
booking.
upon the, you know, the students, and depending upon the, you know, the applications RCOG receives. So usually it is January, July, and September.
Yeah, sometime.
Okay,
I
ma'am.
think they started this September after COVID, right, ma'am?
Exactly,
Yeah.
after COVID.
Before it was just twice, and after COVID, they had also in the September. So in preparation, we'll be
Okay.
covering all the guidelines, okay, that we have mentioned earlier, the GTG, NICE, TOGS, the important SIPs, BASH, okay, FSRH, all these will be covered. Along with that, also the important, the questions, okay, for the exams. And lastly, there will be the revision also for those who have joined the courses. After the classes, at the end, we'll also have the important revision for them. And there will be separate website for them, which will have plenty of question banks for them to solve. And also we can take the mock exams there at the end of the course and when your exams are appearing near. So that also will help you for the assessment, okay, in which part I have to work more, okay, which part I know well, that will help you a lot. So these are the general advices, okay. First is to organize yourself and make folders of all the modules. So this is the screenshot of my iPad. So this is how I used to keep each of my materials, like the oncology inside one folder, so subfertility under one. So if I have to check something, I don't have to keep on searching for the material because there'll be plenty of materials to go through. So if I just tick the subfertility, then I'll find whatever I need to study from there. So this is how if you guys organize yourself, it will make your thing really easy to revise also. Okay, you will not waste your time in searching the materials. So secondly is have a good grip on all the salient points from the guidelines and TOG article, like Dr. Satish asked. Like if you go through the guidelines once through yourself, then it will be very easy when the mentor is taking the class, okay? You will be more clear than when if sometimes when you're not well prepared, then it might be difficult for you to understand, though they teach very well. There's no doubt in that. But if you are well versed with the guideline, once you read it, then it's very it will be very easy for you to understand. And if there was something doubt when you read, you didn't understand something, that you can put your questions there, or also in the chat group, you can share a screenshot like I didn't understand that, and they'll make it clear. Okay. Thirdly is to put a high emphasis on facts, figures, and percentages. There are multiple percentages, but it's not necessary you remember all. Okay, but there are must know percentages like certain incidences, recurrence, prevalence rate. Okay, so that you have to know, because also in the past questions also we see they are asked, okay, though they have decreased the number of questions of percentages, but still there are must know percentages. Okay, fourth is you also have to be very active. It's not that you've joined the course and just be laid back and not do anything. I advise like everyone, like just post as many questions as you can. Like if each one of you even post like 2 questions a day and you guys discuss, okay, and then if you are 10 in the group, then you'll easily be solving 20 questions in a day. Okay, so you also have to be very active. And another is like discuss with your friends as much as you can. Okay, as I said, if you can make a study buddy, it's good, but even if you can't make, it's okay. Okay, in the group there will be other friends also. If you post something, there'll be always one or other friend who will be online, and you can have an active discussion. And if you discuss, okay, you won't forget about it in the exam. You will remember, okay, this I had discussed, so this is the correct answer. Okay. And if I already said that if there's any confusion in the topic, you feel, okay, this might not be the correct key given in the book, then always have a check, okay? Go through the guidelines and TOG article. Always have your concepts clear. Don't go with the confusion. Don't sit with any confusion in the exam. I advise like you make your own small notes, okay? Like to write all important points that is given. And like what we would advise is for those who are sitting in exam for July, okay, for January, we have a very compact course for them for 2 months. For those who are staying for July, okay, we have like, you guys have plenty of time, but not to waste, okay. For first 3 months, just try finish reading or everything, okay, all the guidelines. And the final 2 to 3 months till you have the exam, you revise them, okay, because you have to revise. Otherwise, you keep forgetting things. So this is the picture, okay? And another advice I would like to give is like this is the algorithm of postpartum hemorrhage. Pardon the picture quality and my handwriting. So this is just an example as how I prepared, okay? So this I used to photocopy or like print out all the algorithms, okay? That was like Dr. Zaib's golden advice for me and like my batchmates. She told like print out all the important algorithms and go through it before your exam, okay, last 1 week or all that. So I used to listen to her. I used to print out these algorithms and then make my small notes on that, so that when I just look at this algorithm once, I would get all the necessary information about that guideline just looking at the algorithm, okay. So you might have seen like I've written certain points with my own handwriting here and there. So you have to have your own notes.
Excuse me, ma'am.
Yes, yeah.
Any specific books to be followed?
No,
There
it's
is
all
no
the
book.
yeah,
There is
yeah.
no specific
Only
book.
guidelines.
Ah,
Okay.
only. It's not
Only
only. It's not only. It's guidelines.
Yeah. Guidelines. I don't have idea. That's why I'm saying only.
No. The thing is, there is
Yeah.
no, yes, I got your point. There is no one theory book. Okay, sweetheart. So you have to
Okay.
cover all guidelines, all talk articles. So it is relatively, and in fact, not relatively, it is entirely different from part one, where you just have to mug up only one book. Okay, the Oxford, the revision notes. But
Yeah.
in this part two, you have to, the skim and scan so many guidelines. By the end of your preparation, you will be in a mode where you can correlate so many guidelines, because it is like, I mean, kind of pretty clinical. Okay, for example, if there is a case of the labor, so labor can be breach in labor, it can be the for example, patient is here for vaginal birth after cesarean section, it can be the any normal labor, it can be prolonged labor, so any labor. Okay, so there are plenty of guidelines. So of course,
Yeah.
in the labor part, what you have to do is then you have to bring almost all guidelines, and then you are going to correlate them. Okay, so it is like this. So like Maryada has said, so almost the many guidelines have the in the end they do have these algorithms, okay, management algorithms. I'm sure you all know that we have got couple of obstetrical emergencies. Can anybody name what are the names of obstetrical emergencies? Like this PPH, and what else?
PH.
PPH, yes, very good. And cord prolapse, shoulder dystocia. Yeah, isn't it? Maternal
Yes.
collapse. All right. So almost all these guidelines have algorithm. So we do follow all these algorithms, even in our countries, even of course at the NHS UK as well. So this is a good idea that from the end of that the guideline, you can print, like Maryada has done this. You can print this algorithm. You will keep the all algorithms with you, or even if you are well versed with writing and the memorizing it, this is even the good part. Okay. So what you can do is that
Okay.
on that page you can even note down your the own points, like Maryada has done. So you have your own summary ready. You have your own summary ready in your own words. Got my point?
Yes, ma'am.
So see,
Ma'am,
this is how. Yes.
ideal time for preparation, ma'am, for part 2, like 6
See,
months,
yeah, more than enough.
3 months.
Yes.
Yeah.
6, at least dedicated 4 to 5 months. Dedicated 4 to 5 months mean that at least you have to study on daily basis. Okay, it's not like that one day you will sleep and after 7 days you will wake up and then you are going to see, oh my God, I have wasted my 7 days and how am I going to cover my the whole syllabus? I'm
You
lagging
just
behind.
end up being guilty. You wasted your 7 days.
Exactly. So you have to
Mom, if
study
I'm
on daily
working
basis.
like 12 hours per day, so I can
12 hours?
go
No.
for.
Who said 12 hours?
No, I'm working 12 hours a shift
Okay,
per
you
day.
are working. You are working 12 hours per day. So of course, then sweetheart, you will have to they give time. Okay, You will have to
I
give
have
at
time
least-
for it for July, or I have to delay it, or what?
No. July is okay. July is okay.
Don't
If you will start from
delay
now
further.
onwards, if you will
Yeah,
start
I'm
from
talking
now
about
onwards,
July.
no. You can easily finish it. 7 months and 2 months, 9 months. Oh, come on. 9 months is okay for every OBG, isn't it?
Yeah, even our child will be
Okay.
born.
Yeah.
Okay.
Yes, 9 months is okay. Okay. 9 months is pretty okay. Yeah.
That's a
Yes.
good. Yes, and so also like
It's
make a
8
small
months, not 9.
Okay, preterm, no
But that's
problem.
still a good time,
Even if
like
survival is good.
yeah.
Okay.
Okay.
Months, like people usually take 4 to 6 months, so it's a pretty good time. Okay. And like making your small notes is see, like sometimes people like making notes, they copy each and every word, even like however, therefore, everything they copy. Like don't make such notes. Okay. Make it to the point. And if you have like made notes and you are going through your questions answers, okay, your SBAs and EMQs, and if you see, okay, this question had come here, so as if you can see in this picture, I have written SBA. Okay, SBA made a star. Okay, so that way when you read next time, you won't need to go through all whatever note you have written, but just the highlight the important points, so that you can just, okay, your brain just takes a photograph and you can remember, okay, this is important, so I have to focus more on this point. Okay, guys.
Okay, okay.
Okay. And like, so how to make note is like, make it in a summary. A point wise summary would be more like, okay, apt for your brain to really capture it. This is a summary I've made of assisted vaginal birth. Okay. You guys will come to know about it when you are going in the course. So in this, usually the questions they ask is whether to go for CS or forceps or vacuum. Okay. Usually the question will be that. So depending on that, I had made my own note, like what option if comes, like what buzzword if comes, then what will be the answer. So even that, it will be will help you with understanding and identifying the buzzwords and to get the answers. Okay, and if it's point wise, it's more better. Okay, so yes, this much it is. And who will be your guides and gurus are like my favorite and my wonderful Dr. Zaib. Okay, another wonderful person, Dr. Muhammad Hassan.
Yes.
My
Yes.
very dear Pradnya ma'am. Okay, with myself, and we'll have Dr. Maliha and Dr. Anam as well. So we'll have plenty of people with you to team as a team to guide you and help you in your journey. Okay. So if there is any questions, anything you can ask now, or this is the contact course coordinator's number that is shared. So you can also, contact them.
Okay, ma'am.
Okay. If there's
Ma'am,
any,
how total numbers of GTTs?
80 plus.
yeah.
80 plus.
You don't
So
get
that's why.
like scared with numbers. I would suggest
Yes.
that.
Yes.
You know, like I did my part 1 in February 2020, just before the world shut down, before COVID. It was on February. And I was so happy with my result of when it came in March. Then I started wasting my time not studying, because every time I would see, okay, there are 80 plus guidelines and I also talk and this and that. I'll not do it. Let me just have MRCOG part 1 degree. Okay, it's not even recognized having just part 1. So don't get overwhelmed. And one day I was just scrolling through my Facebook and I saw this Medexam course was starting for part 2. And I thought, without wasting a second, I have to join this now. I can't be wasting more time. Okay. So when I joined the group, and they made it so easy, like breaking it down, okay, bringing the mini schedule and then doing the live sessions also. And at the end, like just listening to the live sessions also, so many things were covered. So don't get scared like they are 80 plus or 100 plus. It doesn't matter. When you're starting with Medexam, the numbers doesn't matter. The quality of teaching they give, okay, the time they provide to you, you will easily be able to give that. I can say that because I myself was student of Medexam. So I can definitely say that. I can validate it.
Yes. I want to show something to all candidates, that how to read guideline, if you just, they allow me. So it will be easy for them that the how it is going to be, and how you can, the make your own, the notes, and how you can, the cover. Okay. So I have
Yes.
just downloaded this guideline. This is shoulder dystocia guideline. This is guideline number 42. Can you guys see the screen, right?
Yes,
Uh,
yes, we can.
yes, Nisha,
That's
it
fine.
is going to be start from 1st of November. Okay. So all of you guys, I have downloaded this guideline from the Google. Okay. So this is shoulder dystocia guideline. So, and this is my the kind of the guideline. So what I will do is that I will study from here. What is shoulder dystocia? First of all, I will try to find out that okay, this is shoulder dystocia. Objective diagnosis is 60 seconds from the if head to body delivery time is more than 60 seconds. So I will if you are the e-person, so you can download all these stuff in your the laptop or MacBook or whatever you are using. For me, I'm pretty old school of thought, so I bought a printer for myself when I was studying for part 2, and that printer is still helping me. Okay. So so I used to print my daily guideline. I used to keep that guideline with me. Okay. And all the time I used to read it, and I used to the highlight my the own points the with my own highlighter or whatever. Okay. So because I like colors, so it gives you the very good feeling when you are reading and when you are highlighting something. For example, I have highlighted okay this much. Okay, this is my the definition. Now I will go to here, and then I will see what is the incidence. So studies involve that the largest number of the vaginal delivery report incidence between 0.58 to 0.70. Okay, so this is my the incidence. Then I will go for okay pph. If shoulder dystocia happens, so postpartum chances are 11%. Okay, 4-degree perineal tear is 3.8%. So I have highlighted it. Brachial plexus injury is from here 2.3 to 16%. So we can just imagine that, for example, if we are in the labor ward, and if we have come across with shoulder dystocia, so we can the easily the imagine that okay these things can happen. In now this is important. In the UK and Ireland, the incidence of BPI is 0.43 per thousand births. Okay, so I have highlighted it because this is important point. Everything which is coming in every guideline in terms of incidence, in terms of recurrence, in terms of the complication. So you will write down. Then of course, if any shoulder dystocia has happened, so how you are going to diagnose? Now, the question is, can shoulder dystocia be predicted? So it cannot be predicted, and but you have to do the risk assessment for the prediction of the shoulder dystocia. But guideline says that 50% of the shoulder dystocia can occur even in the the less than 4 kilogram baby. 48% mean that is going to make 50%. 50% of the birth complicated by shoulder dystocia occurs with infant who weigh less than 4 kilogram. 4,000 gram. Okay. Then you have to note down from here what are the risk factors. Okay, birth weight, infant of diabetic mother. Okay, so these are the risk factor. Okay, pre-labor, intrapartum. So I will the memorize these risk factor. Then is there any the prevention of shoulder dystocia? Then I will read this. Then there is the another question which also comes in our mind as a OBG candidate, that can elective cesarean section be recommended for suspected fetal macrosomia? So then it is like, I mean, we do have 4.5 kilogram. If the birth weight, the estimated birth weight of the fetus is more than 4.5 kilogram, then yes, we can go for elective cesarean section. But less than that, yes, that can deliver vaginally. Then, okay, for the guideline, always remember, if you guys can see that, this is highlighted, the part, this is, the bold letters. You just have to read these bold letters first, and then you have to go into the detail. Okay. First, make your concept. These bold letters will make your concept, and then you can go into the detail of it. Okay. Then there is, what are the recommendations for future pregnancy? Okay. Then in future pregnancies, it is written the rate of shoulder dystocia who have had a previous shoulder dystocia has been reported to be 10 times higher, and the recurrence is going to be between 1 and 25%. So it is important for me for the exam perspective as well, because in exam they can ask in terms of incidence, they can ask in terms of the recurrence as well. So I will highlight this point as well. Now the question comes, management of the shoulder dystocia. And this is where that we were talking about, at the end of all guidelines you do have an algorithm. Okay, this is McRobert maneuver, I'm sure you all know. Okay, McRobert. Then you will do suprapubic pressure, then you will do the maneuvers, delivery of the posterior arm. Okay, or you can do the the all four position and all. Then this is the algorithm we were talking about. So what you will do is either you can write, or either you can print it yourself. So the first exam question is call for help, discourage pushing, McRobert maneuvers. Okay. Then suprapubic pressure. Suprapubic pressure for how many minutes, how many seconds you have to give. It is written in guideline. So you can write it down over here that okay, it is for 15 seconds. Okay. Then consider episiotomy. Then you will go for internal rotational maneuvers. Then you will go for delivery of posterior arm. It can be done, the either way. It can be done, the one after one. Then you will inform consultant. These are the, if above maneuver fails, then you will do this. Then destructive maneuvers, clidotomy, Zavinelli, and symphysiotomy. Then from, this is how it goes. So from here, you can write down your own notes that, okay, this can, come under this, we can write like this. Okay. Now let me show you that these are my notes, what I have made for shoulder dystocia. For example, this is guideline number 42, March 2012, incidence is this, recurrence is this, PPH is this, 3rd and 4th degree perineal tear is this, brachial plexus injury is this. What are the risk factors? I have noted, noted down all. And brachial plexus injury, what are, the important numbers? If you can see, I have, they highlighted all of them. So, the conventional risk factor will predict 16% of shoulder dystocia. Then I have done, how am I going to do the elective lower segment cesarean section for more than 4.5 kilogram baby. Success rate, McRobert 90%, all four position 83%. Okay, suprapubic pressure should be done for 30 seconds. Risk of humeral fracture, humerus, okay, with the delivery of posterior arm is 2 to 12%. Lateral femoral cutaneous neuropathy is associated with shoulder dystocia. Shoulder dystocia drill should be done annually. Okay, so all these points I have noted down from shoulder dystocia guideline. And trust me, till date, I only revise these points and I go, wherever I have to speak for shoulder dystocia, or if at all, if I'm teaching, if somebody is asking, the students like you, if they are asking, so I will quickly open my notes, or I will, quickly open, whatever, the area where I have saved all these things. So I will open, I will cross check from the guideline, and then I will answer. I hope it will give you an idea that how to read guideline. Yes.
Yeah, for the topics, I have to read the topic from all the guideline. I mean, for the like for shoulder dystocia, I have to read it from NICE and Green Top guideline or
no. See, sweetheart, Green Top guideline. If Green Top guideline has any topic, so you will prefer Green Top guideline because your major curriculum is Green Top guideline. Okay, you are not going to study the same topic from TOG, TOG article, or from any other sources. Okay, you got my point. Okay, so for example, if shoulder dystocia you have to cover, so Green Top guideline is enough. Obstetric cholestasis, Green Top guideline is enough. If you have to cover malaria in pregnancy, Green Top guideline is enough. If you have to cover, the GBS in pregnancy, Green Top guideline is enough. You don't have to cover any of the, trust me, any source whatsoever. In the NICE guideline, we do have couple of, the good, topics. For example, diabetes is from NICE guideline. Hypertension in pregnancy is from NICE guideline. Labor guidelines are NICE guidelines. Okay. So
you will tell me in the course from which guideline I have to study, and you will guide me about it.
Of course. Otherwise, it's a good idea for all of you who are beginners for part 2. Scroll through how you are going to, the cover. Let me tell you, the how you are going to, the scroll through, the this. Always remember that, you will write, whatever you want. For example, if you can see my screen, I want postpartum hemorrhage, the hemorrhage, okay, GTG. I will search, see, postpartum hemorrhage, okay, it will come, diagnosis and treatment, this is Green Top guideline. So I will quickly go to, the Green Top guideline. Search and serve. See, is there any difference? See, this is for management of postpartum hemorrhage. So I got the guideline. Okay.
This is nice.
Quickly, no, Green Top guideline, not NICE guideline. For the NICE guideline, you will do the same. For example, I need diabetes in pregnancy. Then I will write NICE. See, this is NICE. You just need to cover, this is download guideline. Okay. This is your diabetes in pregnancy management. See, green top guideline will be green. So you will easily come to know that, okay, this is GTG. Okay, this is GTG, green top. Okay, green top, of course, they have, the specific color, and you will have this logo. And if you have to, the at all, you have to cover the NICE guideline. The NICE guideline will be this, and it will be pure white. Okay. You got the
Okay,
point
ma'am.
now?
So I'm waiting for the material in the course. So I will print all of it better. It's like book, right? It's
Yes, you
better
can do
to
that.
out.
But it
Yeah.
will be so messy at times. So it's all up to you that how it is feasible for you. But because the guidelines keep changing as well, so I will not recommend you to print all material today. Okay. So the guideline might change. So you will go the module by module, and you can do like that. Okay. So it will be the handy for you. It will be the easy for you as well. I hope it is clear now. Yeah.
Okay. Thank you, ma'am.
Can you hear me?
Yes.
Yeah. There are some guidelines, let's say an X topic, and that guideline is of 2016. Do I stick to reading 2016 guidelines?
No. If it hasn't been updated, so yes, that is the only source we have. So we just have to cover that. Okay. So that's why it is recommended that always, the download from original site, because on the website, the we all mentors are working day and night. So we do keep a strict check that the which guideline is changed, which that we have to replace, which we have to the summarize again. So we do that. Okay. How many modules are there? So roughly, we do have almost, the 18 modules. Okay, 18 modules. Let me show you that what are the module list. So, you will quickly have an idea. So for example, we have, the clinical skills, teaching, appraisal and assessment, information technology, clinical governance and research, core surgical skills, post-operative care, surgical procedures, antenatal care, maternal medicine. Yeah. Then comes management of labor, management of delivery, postpartum problems, gynecological problems, fertility, sexual and reproductive health, early pregnancy care, gynecological oncology, urogynecology, and pelvic floor problems. So sometimes, the modules will be merged, like labor and delivery will be merged. Okay. And then from here, the clinical skills, teaching, information, clinical governance, they will be covered in one module. So this is how, it is going to be roughly 13 to 14 modules. Okay, iPhone, if it is clear to you.
Yep.
Okay, great.
Ma'am, how can we read the NICE guideline? It is too lengthy.
Well, you have to read it. Okay, of course you have to read it. The thing is, you have to read it. You don't have to, the read from cover to cover, of course. Okay. So, but you have to cover it. You have to cover at least the salient points, the big stuff. Because NICE guideline is basically for clinical, the practice. Okay. So these guidelines are for, the clinical practice moreover. But for the exam, we don't have any other source. So we have to follow recommended curriculum. Okay. Because in the NICE guidelines, somewhere, in the end, they do have, the huge list of contributors, they have huge list of references. So of course, you don't have to study that. Okay. Yeah. All right. Any other question?
No, ma'am. Looking forward for joining the course.
Okay. Thank you so much. So I hope it is little bit beneficial, that how you are going to study. And like Maryada said, let me let me repeat it again. Don't get overwhelmed from the number of guidelines. Okay, this is going to be there. You are in this MRCOG business, you have to study. Okay, when we can pass, I can pass, Maryada can pass, so everybody can pass as well. All you need is what? All you need is study. All you need is what? To take the the proper guidance, take the proper. No, it is not scary. It is not scary, because the syllabus is so huge. So of course you have to give your extra effort. Okay, so you have to put extra effort. You have to the study. You have to study thoroughly. Okay, you have to study thoroughly because you don't have to leave any loophole behind. Okay, you have to cover each and everything. Okay, so if you will see, nobody knows. I mean, do you ever know that, what will happen, the next minute? Nobody knows, right? But we are living. We don't know what will happen, the next week. We don't know, right? So, but we are
Yeah.
striving, we are thriving, we are living for that, the next week, isn't it? So all you have to do for the part 2 as well, you don't know how the exam is going to be, you don't know what the question will come, but at least you have to be prepared. You have to give your 100%, and then of course, I mean, the things are going to be easy, smooth, isn't it?
Okay, ma'am. Thank you, ma'am, for your motivation.
Always, always there. I'm a very, the bhashan guru. Okay, so you will
Actually, I was
listen to.
planning to postpone it. Yeah, because I don't have any gynaec experience. But after listening you, I'm I'm
Arey
planning to take the
Baba,
course.
no problem, no problem. You can always quote my
Yeah.
example, okay? And
Okay. Okay.
because I have so many, the funny stories while I entered into gynae. So it was kind of very funny for me as well. I was standing in the labor room, so without any clue that what to do, what not to do. Somebody asked me that, can you please examine that patient? I said, I don't know, I don't know how to do the examination only. Can you do the pervaginal exam? So I didn't know anything. Okay,
Okay.
so doesn't matter, doesn't
Okay.
matter. Okay, you will
I
learn.
find myself so funny.
Mhm. Yes. Oh, I think Dr. Satish got disconnected. Anyway, thank you so much,
No, no,
everyone.
I'm there.
Okay,
I'm there. Can you listen?
okay.
Actually,
Yes,
I
now.
find myself little funny that
Uh-huh.
at this age I'm reading MCQs. I write chapters on PGD on text in textbooks, and I am landing up reading MCQs.
Oh, no, 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 no. See, education doesn't have any age limit. Okay. In
You
the
know,
last
you know,
part 3 exam,
I I
February.
I I made videos and answering exam questions for undergraduate students on X-rays in obs gynae,
Mhm.
pelvis and IUCDs and lost IUCDs. And I
Mhm.
made all these algorithms for one of my teacher who writes many books in obs gynae, Dr. Shashank Parulekar. I was his
Mhm.
lecturer, and I
Very
wrote the
good.
full section of infertility only on flowchart.
Mhm.
Infertility fully on flowchart. And now when I read obstetrics, I sometimes feel, oh God, after 30 years, I'm sitting on the same table again.
See, let me give you another example, Satish. You will be amazed. In last February exam, I had, the one candidate for part 3. She is just 72 years young.
Oh
Okay.
God.
Yeah. So it doesn't have any age limit. Okay. So please never think like this that, and even till date, I have, the two candidates. One is 58 years and the other is like, I mean, I think she's turning 63 this year. Okay. So,
Okay.
so education doesn't have any limit, and
No, that
they
that's why I
really commend.
realized. Once I started reading, that's why I realized it's fine. Actually, what has happened? If you say nice guidelines and all, for me, infertility, I may not have to touch the section only because
Exactly. So that
I've
is,
been
yes,
reading all
that
those
is a plus point for
DNMT.
you. That is
Yes,
a plus point for
but
you.
yes, yes. But what
Yeah.
happens out of 100 questions, there may be 5 or 6 which are infertility, and it may not be that in depth of infertility. It will be just upper part of infertility.
Exactly,
That's
exactly,
the only thing.
exactly.
So let's
No, no,
hope for the
inshallah,
best.
you will enjoy, and you will enjoy studying because every time, we have to revise, we have to improve on ourselves, okay? And
I laugh. I my kids are laughing. Okay, that dad is reading these books. My both kids are
oh,
just joined post graduation. One is doing
mashallah,
general
that's great.
medicine and other is doing MS orthopedics. My
Mm-hmm,
wife is also MD Gynec, and now when she sees me
mm-hmm,
reading MCQs, all three laugh at me. I say I have no other choice, but if I have to start PGD setups in
mm-hmm,
Middle East with my business
mm-hmm,
module,
mm-hmm,
I have to
mm-hmm.
go through MCQs.
No, you can go through easily, and I hope with your knowledge, we might get the help as well in terms of the infertility. Yeah.
IVF and PGD for me, I don't need books. I don't need any classes also. But the problem is, the last I delivered was 1996. My own kids, twin pregnancy.
MashaAllah, that's great.
After that, I have not touched needle holding forceps. I've only done ovum pickups, and embryo transfer.
Now you will learn.
I have to.
Yeah. You have to improve on
I don't know. Sometimes it's country's unfortunate part. I don't know. I mean to say, I'm not going to practice obs and gynae in the Middle East.
Yeah, but it's all like, I mean, opportunities and how you want to pursue and what you want to do.
At this age, see, I passed in 93. In 93, there was no, when I came to UK in 95, July, okay, there was no fellowship in IVF. There was no fellowship anywhere in the whole world. And at this age, now they have revised the guidelines everywhere and they want a fellowship. You can't expect to leave everything and go and sit somewhere and work as a fellow for 3 years and give the exam. It's difficult.
Yes. It
they should have made a bridge for something of that sort, I don't know. But you can't do much for them.
Exactly. Anyway, thank you so much, Dr. Satish. So candidates, if there is any other question for any guidance, anything which is not clear, anything which we were not the clear in the clearing anything.
Okay, thanks a lot. Thank
you so much, Satish. Happy Diwali.
Happy Diwali. Thanks.
Yeah, thank you, Isra. So if anything is left, if there is any confusion, so you guys can always ask, okay? Definitely. What will be cancelled? If you will not, give your part 2 within 10 years, it will be cancelled. Of course. But I don't think that, somebody has to wait that long to appear in part 2. It's better to get it over with, okay? So give your part 1, immediately give your part 2 once you are ready, and go for part 3 and become MRCOG, and that's it, flourish. Every exam give you extra knowledge, every exam give you confidence, okay? Every exam gives you, the in terms of, this MRCOG itself, this is a standardized exam. This is, the recognized all around the globe. And, the moreover, if anyone who doesn't want to even practice, the gynae, but trust me, it is going to open, there's so many doors in terms of, the education, in terms of knowledge, in terms of, how you are going to manage. So, I mean, things are going to be very easy after that. Okay.
Yeah.
Oh yeah, take OET and go to UK. anytime. Okay, guys, thank you so much. So we won't keep you guys long because I think the Diwali festivities are already there. Okay, so happy Diwali, everyone, whoever is celebrating today. Okay. Part 3 until it is online, so it is allowed in Pakistan, but usually it is not allowed. Okay, Pakistan is not a center for part 3. Till it is online, then yes, you can sit at home and then you can give, but it all depends upon that your luck, your whether you get the seat online or not.
Excuse me, is part 3 allowed for Bangladesh?
No, sweetheart. Bangladesh is not a center at present. Only India, India, UK, Hong Kong, Singapore. That's it. These are the part 3 exam centers.
Okay, thank you.
Okay. That's great.
Okay, bye.
Okay, everyone. Thank you so much. Happy Diwali. Celebrate, and thank you so much, whoever was present here. If still there is any question, any query, reach out to us. We are, the very easily approachable. Me, Maryada, and all of our, the part 2, the mentor groups. So, we are there. Okay. If there is any query, any question, any concern, do write to us. Do write to our team as well. So, inshallah, we will try to be as helpful as possible. Okay. Thank you so much.
Thank you.
Okay. Bye. Take care.